CHF. You're going to hear about it in class a ton. The reason why so many people will call you, they'll call 911 in the ambulance for heart failure symptoms. So what we have to understand is congestive heart failure means, by definition, the heart has failed as a pump. The patient is now symptomatic, and they're calling 911 and saying, I need help, I can't breathe, I have chest pain, etc. Let's investigate what this is all about. Look at my key terms. So CHF, congestive heart failure, is a chronic condition, okay, but it can happen acutely. Heart failure by itself can happen acutely, but someone in their medical history will be diagnosed by a doctor and say, you have CHF, which is another way of saying, hey, you have a weak heart. You got an at-risk heart, okay? Now, CHF is a chronic condition affecting the heart chambers due to damage and or weakness. Some pearls. The heart is unable to pump blood to meet the demand of the body. That's heart failure. That's where we get in trouble. That's where we can end up in shock, which is cardiogenic shock, which means it's the heart's fault. If someone's in bad CHF, they could end up in shock, meaning blood is not being pumped to all of the tissues and all of the organs in the body, which means blood and oxygen is being pumped to all the organs in the body because the heart is only pump blood around our body. And I'm telling you right now, the heart has failed. Right. So it's commonly associated with older adults, but it can occur at any age. Now, folks, we're going to talk about this. We're going to go really deep on this. I'm going to show you. This is right. This is left-sided heart failure. We got two sides of the heart, right? So can we have left-sided heart failure? Yes, we can. Right-sided heart failure or both? Yes, we can. We're going to talk about that. So it typically starts as left-sided heart failure, then progresses to the right side if left untreated. And we understand this if we understand heart blood flow. So remember this. Before we move on, I'm going to share something with you. Remember this. If the left side of my heart fails, blood backs up into the left atria, into the pulmonary veins, right? Okay? So that is a reminder to us that, oh, okay, blood backs up. But if blood backs up into the lungs, use that train of thought. It can remind you that we end up with fluid in the lungs, okay? Pulmonary edema. If the right side of my heart fails as a pump, the right ventricle, well, blood isn't moving forward as well, so it backs up, if you will, using my train of thought here. Right ventricle, right atria, now we're in the venous system. Well, if the right side of my heart fails, blood backs up in the venous system. Okay, well then, what do I get? Well, you get edema down the legs, and we get JVD, jugular vein distension. So simply put, left side of my heart fails, I get respiratory symptoms. If the right side fails, I get venous retention. We can see in JVD, right? Okay, so that's the beginning of this. Let's continue a little bit more. So, what are the causes of CHF? Well, first off, folks, if you're having a heart attack, we can have signs of CHF, like acutely, because you're having a heart attack. Your heart has failed as a pump, and we're getting left and right side heart failure, or both, because of your heart muscle is literally dying. Heart valve damage, chronic hypertension. Now, again, we talk about why is someone diagnosed with CHF? They're diagnosed with CHF because maybe it's their chronic hypertension. Maybe it's their heart valve damage. Maybe it's their heart disease. Maybe it's their cardiomyopathies. Maybe it's their congenital heart disease. Maybe it's lung diseases, right? Renal failure, pulmonary embolism, noncompliance with medications. All of this can lead us to CHF in many ways. All we're saying here is all of this, it might end up in your heart failing as a pump. That's the baseline look at understanding, okay, this is heart failure. So remember, folks, take it to the bank. This is why I tell all my students and how they do so well, because they never forget this. in CHF, in heart blood flow, if my heart fails the pump, what happens? Blood backs up. So on the left side, blood backs up. Respiratory symptoms. Right side, blood backs up. Venous symptoms. Because we understand heart blood flow, now just from that simple thought experiment that we've done here together, we now understand the hallmark sign and symptom of left and right side heart failure, thinking about the anatomy of the heart. Pretty cool? All right, I love it. Let's continue. Hope you're enjoying our lessons today. If you don't know, in the first link in the description is my video vault training. What you get there is access to over 480 videos and over 2,000 national registry practice test questions. And we cover every level: EMR, EMT, advanced EMT, paramedic. This is where I send all my students, whether you're getting ready for school, you're in school right now, or you're getting ready for your national registry exams. You'll see this video right here. Go watch that video and I will tell you all about it. Let's go back to the lesson. Now, eventually, this compensation fails due to the increased weakness of the myocardium, the heart muscle. Blood backs up into the lungs. The left side of the heart is unable to pump blood effectively, so blood backs up into the pulmonary veins and lungs. The pressure increases in the capillaries of the lungs. Here's the big pearl. From excess blood, fluid, mainly water, you may have heard the term, well, basically, somebody in heart failure they're drowning themselves, because fluid, mainly water, eventually leaks from these capillaries into the alveoli, where all the gas exchange occurs, where we bring all the oxygen into our body due to excess pressure, and we get something called pulmonary edema, which is fluid, mainly water, in the lungs. That's left side heart failure. Now let's continue. So here are signs and symptoms of left side CHF, left side heart failure. So first we have our respiratory distress. So has difficulty breathing when lying flat. Folks, you will be called multiple times throughout your career, more times than you can count, for someone that has heart failure that has literally woken them up out of their sleep, okay? That is something that we think about, right? They're laying flat. Someone can't breathe and they're laying flat. We want to sit them up so they can breathe better. First thing, before we do anything, sit them up, okay? Foamy pink tinged sputum. This is big on exams. Pink tinged sputum. It's talking, what's that from? From blood. So that foamy pink tinged sputum with cough, think CHF. Okay? Episodes of difficulty breathing while sleeping that wakes the patient. I just talked to you about that, right? Okay? What else? Abnormal vital signs. So we talk about blood pressure. That's blood pressure is possibly on the higher side, okay? The heart rate increases to compensate for a decreased stroke volume. It may be irregular if a dysrhythmia is present, and also an increased breathing rate. So what's our patient going to look like in CHF? Well, what they're going to look like is high blood pressure, high heart rate, low SpO2, and increased respiration initially. Now looking over some more here, JVD. JVD is a big pearl. Why? Blood backs up. Right-sided, we get JVD, okay? JVD indicates they may also have right-sided heart failure. That's what we're talking about, okay? This is all left-sided, but if we have left-sided, it can lead to the right, okay? Patient can be diaphoretic, chest pain, lung sounds, cyanosis, and then again, confusion, agitation, right? Big pearl on lung sounds. What's the big pearl on lung sounds? Rales, also called crackles, bilaterally. That is your clear-cut CHF. Rales bilaterally. That is the most common presentation you'll hear on for exam. Now, folks, what do we talk about? Left side heart failure can lead to right side heart failure because blood backs up into the body in right side heart failure. So left side heart failure, I get respiratory symptoms. Right side by itself, blood backs up in the body. Oh, I got a weight gain. Oh, I got fluid in my legs. Oh, I got JVD, right? So right side of the heart is unable to supply blood to the left side. This can result in decreased systemic blood pressure, hypotension. Your right side, the right side of your heart fails. We're worried about decreased preload, venous blood coming back to the heart, hypotension. We're worried about that. Blood backs up into the vena cava, into the venous system. And what this causes is peripheral dependent edema, swelling in the feet and the legs, most common. It causes discomfort. And if there is a chronic absence of pain sensation in that area, JVD, bulging neck veins, you can't miss it. Folks, I remember the first time in my career I had a bad CHF patient. It literally was easier to put an IV in the patient's neck than it was their arms. And you're thinking, Evan, you crazy? No, seriously, that's how the vein was that large. You can fit whatever you want in that vein, right? That is real true JVD and CHF. You don't miss that. You can see it clear as day, okay? So that's a big pearl. So what we have here with right side CHF, first we have venous congestion, okay? So we talk about the JVD, neck veins, enlarged liver, spleen, okay? Fluid accumulation. We can have ascites, okay, fluid in the abdomen, right? The pericardium, right? Even a pericardial effusion, which is excess fluid around the sac of the heart. Heart rate goes up, okay? And remember this, folks, anytime something bad's going on in the body, not a rule, but usually the heart rate just goes up. So they're trying to compensate by, let's raise our heart rate, and maybe that will help our cardiac output. Okay, that's the idea. Peripheral edema, so it's swelling in the lower part of the body or the whole body. Okay, we have edema for bedridden patients in the sacral region, and also pitting edema. Now, at past medical history, they may have had a previous MI, or they're already going to be on diuretics to control the CHF they're already diagnosed with. Now, here's the part everyone's been waiting for. Now we understand the CHF patient. What do we do for them, right? Let's talk about management of CHF. So we're going to administer CPAP. This is so key, and here is why. You want to take notes on this one. If you want to take notes on any of this, take them here. Might want to pause the video. It decreases preload and myocardial stretch to reduce the workload on the heart and improve oxygenation. If CPAP is not tolerated, we could administer supplemental oxygen, bind on our breather mask or nasal cannula to keep their SpO2 above 94%. So hold on here before we continue. Folks, CHF, how they present, what do they look like? I got chest pain, I can't breathe, maybe I woke up in the middle of the night, maybe I have a history of a heart attack, maybe I have a history of heart problems, maybe I have chronic hypertension, right? Maybe I'm older, 50s, 60s, 70s, 80s, older, right? Okay, what else do we find in this patient? I find JVD. Oh yeah, I had some weight gain, fluid in my legs. Oh, maybe I have more fluid of the lower back, bedridden, the stomach area. Okay, what else? Bilateral rails. Okay, I listen, I hear rails. Okay, they have a hard time breathing. Pink tinged sputum. Okay. What about vitals? Heart rate goes up. Blood pressure initially up. Increased respiration. Respiratory rate up. SpO2 down. That's what they look like. Here's what we do to help them. So the first step is I didn't get your SpO2, your oxygen, back above 94%. So if they can tolerate CPAP, meaning to give CPAP, they have to be able to obey commands. If they can't obey commands, I can't give CPAP. Okay? So the contraindications is they have to be able to maintain their own airway. So the patient is unable to maintain their own airway. Now, some other ones here, recent esophageal surgery, okay? And you're not going to know that in the field, but I did put it on here just for the books, okay? Hypotension, again, this is big. So, follow your local protocols here, but if the patient is hypotensive, CPAP could make them more hypotensive. So we have to weigh it out, the benefit of the patient. Essentially, one, follow the protocol, but two, what's gonna get them first, basically, right? CPAP might be the next best step, but we have other tools at play, so let's talk about it. But by the book, if they're so hypotensive and they're like unresponsive, we're gonna take over airway control. We're not playing around with CPAP, and not a rule, but usually if they're that unstable by the time you get there, they're probably not obeying. Is somebody with a systolic blood pressure in the 70s and 80s, are they usually obeying commands? Wouldn't they be confused? So again, not always, because I've seen weird things, but usually by that point, you're going to manage your airway anyway. So let's continue to the next piece. So next piece is nitroglycerin. Nitro. The nitroglycerin vasodilates to create space for a fluid shift. What that means in plain English is this. It decreases the preload, which is the blood return to the heart, meaning the right side of the heart, from the venous, okay? Which reduces the myocardial stretch, which reduces the workload on the heart. Folks, if you want a definition for the rest of your career, hey, how does nitroglycerin work? Here's how it works. Nitroglycerin is going to decrease your preload and decrease the demand on the heart. And that's why we give nitro to CHF patients. And why we also give nitro to heart attack patients, because the heart is under attack. When we want to reduce the workload on the weakened heart so we can catch up. Right now it's weak. If we allow the workload, I don't gotta work as hard, maybe the heart can catch up and the symptoms can improve. You see where I'm going? That's exactly it. Now, we're gonna administer sublingually if the patient's systolic blood pressure is above 100 and or med control advises to do so if you're at, some EMTs can give it, some can't. Every EMT and paramedic probably has it. They may not, they may. Follow local protocol, national standard. What do I do for nremt? Right here. Above 100, hit it. Unless they're on ED medications. Okay, like Viagra, Cialis in the last 48 hours, sometimes 72 hours. So look here, our contraindications, hypotension. That would be systolic blood pressure of 90 or less, and the use of erectile dysfunction medications in the past 24 to 48 hours. Now, earlier I said 48 to 72 hours. My rule of thumb is if you took an ED med in the last few days, I'm going to call it a contraindication. By the books, this is it. But in the field, you want to be very careful, okay? So the thing is, when we look at the management so far, right? We look at our management so far. Before we get into this last pearl, we're worried if they're hypotensive that we may not be able to give CPAP and nitro. So at that point, we may have to take over airway control. That's essentially what we're thinking about. Now, with CHF, you're going to see it so many times, folks. Somebody in the middle of the night is going to call you and they can't breathe and they're having a CHF flare up. First thing we do, even if you're with a family member, sit them up. We got to sit the patient up. If somebody can't breathe, anybody can't breathe, sit them up. We're never going to lay somebody flat who can't breathe, ever. Sit them up. Okay, it allows the sniffing position and more air to come in, okay? Patients with CHF are often anxious because they're having a hard time breathing. Be comforting, be reassuring, let them know you know exactly what's going on and have all the resources to treat it. Take note of any medications the patient is on and rapid transport. This may be a call where you want to do a radio patch and let them know, hey, get respiratory in the ER by the time we're there, because this is a critical patient. Hope you enjoyed my call today. I'll see you soon. By clicking in the first link in the description, you get lifetime access to my Video Vault program. The Video Vault includes over 480 videos of content and now holds over 2 1,000 National Registry practice test questions. Also include some really awesome bonuses like worksheets, drug cards that are pre-filled out all for you, community group access to ask me questions, and audio files when you are on the go. The Video Vault will find you no matter where you're at, whether you're an EMR, EMT, advanced EMT, or paramedic student. And my students use this whether you are getting ready for school, in school right now, or getting ready to go pass your National Registry exams. So click the first link in the description right now and get yourself lifetime access to the Video Vault today. I'll see you there.